So we move on to, from the ethics committee, if there's no comment or any questions in that particular regard, we'll move on to the standards of practice. Now, remember that they're a little bit different. They're a little bit different for the IMDHA than they are for the IACT, and for purpose of the idea that it's just a different level. A level of that requires licensing in many instances with IACT, and doesn't require any particularly licensing necessarily with IMDHA. And the purpose of the IMDHA Association's standards of practice is to define the scope of practice for its members. It realizes that there's a certain percentage of members that work with other modalities, and some of us are just like me. I don't work with another modality so much as I'm a hypnotist. I'm a hypnotherapist. I'm certified as a forensic hypnotist, but that's another area of expertise and scope of practice that doesn't necessarily involve the this particular set of ethics. It's a little bit different. I have a different responsibility towards that area of practice. And then you have some that use it in conjunction with medical practice or psychiatry, etc. So they're different scopes. And the first scope refers to an IMDHA member whose practice is hypnosis. Members are not necessarily licensed or certified in other professions, and are trained to work independently in the field of hypnosis, the standalone professional, the hypnosis professional. These individuals are facilitators of hypnosis, and their primary function is to assist clients in achieving wellness. So it's recommended that a client sign a consent to receive hypnosis form. It's recommended that the member have a disclosure consent form that includes the following. The practitioner does not treat, prescribe, or diagnose any condition. The practitioner is the facilitator of hypnosis and is not practicing any other profession that requires a license under the laws and regulations of the state or province in question. Hypnosis is not a replacement for medical treatment, psychological service, or counseling. And these professionals are trained to work independently and also complementarily with physicians and counselors and healthcare professionals. Usually when working with other professionals, the client is required to sign and date a records release, and we'll be going through these forms a little bit later on in the program. Scope 2 refers to the IMDHA members who have using hypnosis with a blend of other disciplines, and in that sense it's Reiki, massage therapy, and of course in this instance there may be some licensing requirements, but it's also recommended that a member prepares a statement of disclosure form that provides the client an explanation of the various techniques that he or she is qualified to practice. So there may be some special licensing. I know with massage therapy there's some state licensing that might be required, but they use hypnosis in conjunction with that. Scope 3 refers to members who are licensed and certified in his or her state or province to the practice of medicine, nursing, psychotherapy, etc., or any other healthcare service. And so it's recommended that the members follow the rules and regulations, first of all, that's required for their professional. Remember that we're required to maintain our certifications and maintain a level of behavior concomitant with our highest level of certification and or licensing. So the standards of practice for IACT is a little bit different because of these usually higher there's some licensing requirements that are required for social workers, etc. And the IACT is set up more or less as an association of people who are already licensed in those areas. So the standards of practice is to define the scope of practice for its members, and it's those who use hypnosis with other modalities in conjunction with practices that include clergy, medical practitioners, psychologists, clinical social workers, stress consultants, nurses, etc. Substance abuse counselors. These are all, again, recommendations. It's recommended that the member use a disclosure consent form, recommended that the client sign a consent to receive treatment form that includes an explanation of the various techniques that he or she is qualified to practice. So we have this we have an umbrella type of situation.
Mark, I apologize, Mark, for interrupting you. My microphone wasn't going on. I just asked you a lovely question, and of course, no one heard it. So, so if I might, when you talk here about various, it says it's recommended for the client to sign a consent to receive treatment form that includes an explanation of the various techniques that he or she is qualified to practice. And my question is, and this has been alluded to in a couple of other places, but my question is, isn't hypnosis really an umbrella for a collection of techniques? So, for example, if a hypnotist practices age regression and does parts work and stress management processes and hypnosis for sleep, for instance, is it necessary to indicate all of these techniques on the consent to receive treatment form that's mentioned here?
Well, that again, I think is a little bit on the subjective side, because ordinarily they will have, if you're licensed to practice some medicine, and I'm presuming that they have certain disclosures, etc., that they have to make that would probably be inclusive of anything less. But if you're using hypnosis in this instance, say for instance that you know you go to a doctor who specializes in sleep therapy, you know, it would be almost unnecessary for you to reveal that you're going to be using hypnosis in conjunction with it, when they're a medical professional who deals in sleep apnea, etc., and all of this thing. So I think it depends a lot on the particular situation. It's not like you're talking about someone who is only practicing hypnosis and in conjunction with a doctor who happens to be a sleep specialist or whatever. So it includes an explanation of the various techniques. You might be in a situation of having to say, well, look, you don't need medical intervention, but I can help you with hypnosis, and this is how. Then you may want to include it in your form. But the idea there is that this particular is the consent to receive treatment is more than likely to be covered by the more intensely regulated, professional disclosure form that's necessary when you go in to see a psychologist or a clinical social worker or a stress consultant, etc. But that again, it goes with the suffixes that you put at the end of your name also, and the certifications that you put on the wall. That has a lot to do with the, I'll call it the unspoken and unrecognized magic of telepathy that we call rapport. And what what that would do is that the consent to receive treatment, if you have an explanation that I do all of this stuff, and you have the certifications to back it up, and the research, etc., all comes into play with the entire scenario of the client practitioner relationship. And so I think the consent to receive treatment probably wouldn't need to. You know, if you're coming in to see me for smoking, you aren't really interested if that I have certifications to help people with IBS and fibromyalgia. I've even had success with people with multiple sclerosis in very, very few sessions. I don't advertise it, but if somebody comes looking for it, I have the stuff on the wall, and you know, the books and the research and the, you know, the clients who have been able to benefit. So I think it's all a question of providing the client with the necessary information to take care of the situation that they're presenting.
Great, thanks. That's quite useful.
Okay, let's see. It's also recommended that the practitioner not treat, prescribe, or diagnose any condition outside of their educational qualification. Not recommended that the practitioner not use alternative techniques as a replacement for medical treatment. And notice this is all recommendations. They're not requirements, because of the fact that you're going to be working with other professionals. It's recommended that they have a records release. They have their own protocol between these medical professionals. If you've ever had to have your medical file transferred from one doctor to another, you know what type of restrictions and requirements that they have. So it's probably that more true than not, then they have a lot more restrictions and requirements on transferring medical information than we do as hypnotists. And the very, very most important thing I think we need to remember in this particular area of standards of practice is that IECT encourages its members to be clear about the scope of their practice, as it is important to present to their services in an ethical and professional manner. There's no two questions about that.
Lovely.